Welcome to this presentation. This will be a lecture on the history of psychiatry. We'll be looking at how psychiatry has evolved over the ages, pioneers of modern psychiatry, and how modern psychiatric treatments have developed. Some information about myself. I'm a consultant psychiatrist based in Chennai, which is a city in South India. I have worked for several years in the United Kingdom. The word psychiatry is derived from Greek psyche, which means mind or soul, and iatros, which means physician. The term psychiatry was coined by the German physician Johann Christian Reil in 1808. The introduction of this term was groundbreaking, as it emphasized that mental illness was best understood from a medical perspective instead of a theological or philosophical perspective. And this was the article in which Reil first mentioned the term psychiatry. Historically, the causes of mental illness were thought to be religious or supernatural or possession by evil spirits. Therefore, the treatments for mental illnesses involved elaborate rituals, religious rituals, sorcery, or exorcism of evil spirits. Descriptions of mental illnesses and potential causes are given in the ancient Indian religious texts called the Vedas, particularly the Atharva or Atharvana Veda, which is one of the four Vedas. Ayurvedic texts also mention about mental illnesses. Ayurveda is the ancient Indian system of medicine. Mental illnesses and personality problems were conceived as being due to an imbalance in three mental gunas or characteristics called sattva, rajas, and tamas. Similarly, physical illnesses were thought to be due to an imbalance in three physical energies called vada, pitta, and kapha. Connection between mental and physical well-being seems to have been well recognized. This is an excerpt from the Atharva Veda. Traditionally, Vedas have been taught by teachers to students orally. It is only in the last 200 years or so that attempts have been made to write them down. In ancient Egypt, Ebers Papyrus, which is more than 3,500 years old, is a manuscript which gives descriptions of mental and physical illnesses. Mental illnesses were believed to originate in the heart, which was considered the seat of emotions, as well as being the most important physical structure in the body. Descriptions of mental illnesses in the Ebers Papyrus appear like psychosis, depression, dementia, etc. This is an excerpt from the Ebers Papyrus. The Yellow Emperor's Classic of Internal Medicine is a Chinese text which dates from between 500 and 250 BC. This is in the form of a dialogue between the mythical Yellow Emperor Huangdi and his 6 ministers. Concepts include yin and yang, 5 elements, qi or life energy. This text describes cases of mental disorders in addition to physical illnesses. This is the English translation of that text. Hippocrates is considered the father of modern Western medicine. As dissection was forbidden in ancient Greece, there was not much knowledge of anatomy. Hippocrates separated medicine from religion. He argued that disease was caused by natural factors such as environment and diet and was not a punishment from God. He focused less on specific diagnosis and drugs, but more on gentle and humane care of the patient in order to enable natural healing. He put great emphasis on professionalism of the physician, attributes such as honesty, calmness, understanding, cleanliness, etc. Hippocrates lived between 460 and 370 BC. This is the rod of Asclepius, the god of medicine. This is the Hippocrates symbol. A lot of medical organizations and medical institutions include this in their logo. Theophrastus was a disciple of the great Greek philosopher Aristotle. He is considered the father of botany. He described about 30 personality types in his work, The Characters, and I have listed some examples of those characters. Galen is considered the greatest physician of the Roman Empire. He was a pioneer in the fields of anatomy and pharmacology. He considered profit motive to be the worst reason for becoming a physician. His herbal mixture called Theriac was considered a panacea for most illnesses and is still being used. He felt that interpreting dreams had diagnostic and therapeutic value, a concept which was highlighted by Freud several centuries later. Galen believed that mental and physical disorders were caused by imbalance of 4 humors or tastes in the body. We call them yellow and black bile, and phlegm and blood. So he described 4 types of personalities: choleric, characterized by anger; melancholic, by depression; phlegmatic, characterized by indifference; and sanguine, or cheerfulness. The first psychiatric hospital appears to have been at Baghdad in Mesopotamia in 705 AD. This was followed by a hospital in Cairo in Egypt in 800 AD. Bethlehem Royal Hospital, previously called Bedlam, in London, started functioning in 1247 AD. It is still functional but has moved location thrice. A mental hospital in Damascus in Syria started in 1270 AD. This was the Bethlehem Royal Hospital then. And this is the Bethlehem Royal Hospital now. When I was working in London, this was also part of the South London and Maudsley NHS Trust, and I have been to this hospital many times for meetings. Avicenna was a Persian physician, was also a poet, astronomer and chemist. His famous works were the Canon of Medicine and the Book of Healing. He describes cases suggestive of psychosis, mood disorders and dementia. He was the pioneer of physiological psychology. The modern term for that is biological psychiatry. He developed a system to relate changes in pulse rate with inner emotions. He also gave psychological explanations for somatic illnesses. Robert Burton was an English scholar at Oxford University. He wrote The Anatomy of Melancholy. It is more of a literary work than one on depression. He discussed about how a major loss, such as loss of an attachment figure, loss of status, or losing one's physical health, was an important risk factor for depression. It has been suggested that Robert Burton committed suicide by hanging. Some quotes from Anatomy of Melancholy, so you can pause and go through them. René Descartes was a French philosopher and mathematician. He introduced the concept of dualism, also called Cartesian dualism, that the mind is distinct from the rest of the body. He believed that the mind and body interacted at the pineal gland, which he called the seat of the soul. According to him, vibrations in the pineal gland caused a person to experience emotions. I've listed some quotes by Descartes. If you want, you can pause and go through them. Thomas Willis was a British neurologist and anatomist. He is best known for his circle of Willis arteries at the base of the brain. He also systematically listed the cranial nerves. He attempted to provide neurological explanations for psychological disorders. He made landmark findings in epilepsy also. William Batty was a British physician who specialized in treating mentally ill patients in asylums. He contributed towards increasing respectability for doctors treating mental illness. He was the first doctor specializing in mental health to become the president of the Royal College of Physicians. He improved conditions of patients in psychiatric asylums like the Bethlehem Hospital. His famous work was the Treatise of Madness. Philippe Pinel was a French physician. He introduced moral therapy aimed at improving the quality of care for the mentally ill. He ordered removal of chains from patients in asylums. He made important contributions to psychiatric classification. He differentiated mania from dementia. What he called dementia then later became dementia praecox and is now called schizophrenia. Some even consider him to be the father of modern psychiatry. The York Retreat was founded in 1796 by William Tuke, who belonged to the Quakers religious movement. The aim was to treat the mentally ill more humanely. No chains, patients given personalized attention, promoting the self-esteem of the inmates, a ban on physical punishment of patients, and residents being considered part of a larger family. He applied moral treatment with a focus on religious values. The York Retreat is still functional today, offering independent mental health services. This was the York Retreat then, and this is the York Retreat now. Johann Christian Reil, who I mentioned at the beginning of this lecture, was a German physician, anatomist, and psychiatrist. As mentioned at the beginning, he is best known for coining the term psychiatry. He advocated for the creation of a specialized branch of medicine to treat the mentally ill. He believed that as civilization advanced, the risk of madness increased. His anatomical contributions included discovering the arcuate fasciculus and locus coeruleus. The arcuate fasciculus is the brain tissue connecting the Wernicke's and Broca's speech areas, while locus coeruleus is involved in the secretion of the neurotransmitter noradrenaline. Wilhelm Griesenger was a German neurologist and psychiatrist. He established two psychiatric journals. He promoted the reintegration of the mentally ill back into society. He was convinced that psychological diseases are diseases of the brain. He was a proponent of the concept of unitary psychosis, that is, that any mental illness was due to a single disease process and different symptoms represented different stages of that single process. He postulated a so-called mental reflex similar to the neurological spinal reflex, which if overactive caused mania and which if underactive caused depression. The precursor of the Royal College of Psychiatrists was founded in 1841, and it had a very long name. In 1865, the name changed to the Medico-Psychological Association, which then became the Royal Medico-Psychological Association in 1926. It was renamed as the Royal College of Psychiatrists in 1971. The American Psychiatric Association was formed in Philadelphia in 1844, and it too had a very long name at that time. In 1892, it became the American Medico-Psychological Association, and it got its current name in 1921. Benedict Morel was a French psychiatrist. He coined the term dementia precox to describe stupor. His theory of degeneration was influential for some time, according to which mental illness degenerated with successive generations. So it's a neurosis in the first generation, which becomes mental alienation in the second, which worsens into imbecility in the third, and the fourth and final generation suffers from sterility. His ideas influenced the eugenics movement, which promoted sterilization of those who are considered to be inferior. Josef Breuer was an Austrian physician and neuropsychologist. He co-discovered the respiratory Herring-Breuer reflex. His most famous psychiatric case was Anna O, who suffered from numerous dissociative or hysterical symptoms. Successful treatment of Anna O by allowing her to talk freely, the so-called catharsis, is considered by many to have established the foundation of psychoanalysis by Sigmund Freud. He was a mentor of Sigmund Freud, but they split ways subsequently. They co-wrote the studies on hysteria. Emil Kraepelin was a German psychiatrist. He is considered by many to be the father of modern psychiatry. Kraepelinian dichotomy refers to the distinction between manic psychosis and paranoid psychosis, or dementia precox. He emphasized the importance of genetic and other biological factors. He was also said to be a proponent of eugenics. Sigmund Freud was an Austrian neurologist and psychiatrist. Historically, he seems to have been the most influential figure in psychiatry. He was the founding father of psychoanalysis. Some of his major concepts, I have listed them. You can also refer to my lecture, Introduction to Psychotherapy, for more information on Sigmund Freud and other psychotherapists. Eugene Bleuler was a Swiss psychiatrist. He is best known for coining the term schizophrenia, which replaced the previous term dementia praecox. He also introduced the concepts of autism and schizoid. His concept of autism was more a feature of schizophrenia and not as we know it of now as a developmental disorder. He originally supported Freud, but later criticized Freud for being too dogmatic in his views on causation of psychopathology. So Breuer resigned from the International Psychoanalytic Association. I mentioned a couple of other notable figures. Alois Alzheimer, who published the first case of dementia, and Alzheimer's disease is named after him. And Karl Jaspers was the pioneer of descriptive psychopathology. You can know more about Karl Jaspers and about descriptive psychopathology in one of my other lectures titled Descriptive Psychopathology. So those who are interested can listen to that lecture. So we will now look at the history of psychopharmacology. So I'll be covering chlorpromazine, lithium, and antidepressants. Chlorpromazine was introduced in France in 1951. Promethazine, which is also another phenothiazine, had been developed 4 years earlier. Chlorpromazine was developed by Laborit, Delay, and Deniker. Initially, it was used as an IV adjunct to anesthesia during surgery. It was noticed that chlorpromazine had calming and hypothermic effects. So the calming effect was called sedation without narcosis, and the hypothermic effect was called artificial hibernation. It was marketed widely in 1953 as Largactil. It was called Largactil as it had a large range of activity. Chlorpromazine appears to have played a major role in deinstitutionalization from 1955 onwards. That is, in reducing the number of patients who were inmates of long-stay psychiatric hospitals and their reintegration back into the community. Lithium use in modern psychiatry was pioneered by an Australian psychiatrist, John Cade, in 1949. Previously, lithium had been used for gout and heart disease, but it was banned as it was causing serious side effects. Cade used it in mania after observing that guinea pigs, which were injected with lithium, became tranquilized. It was licensed in the US for manic episodes in 1970 and for the prophylaxis of manic depressive illness, now called bipolar affective disorder, in 1974. So the reason for this long delay before lithium was officially approved, according to John Cade, was a discovery made by an unknown psychiatrist with no research training, working in a small chronic hospital with primitive techniques and negligible equipment, was not likely to command attention. I think this holds true even more so these days. Iproniazid and isoniazid, which were primarily introduced to treat tuberculosis, were the first marketed antidepressants in the 1950s. Patients with tuberculosis who received these drugs were noticed to become happier. Iproniazid was withdrawn in 1961 due to hepatotoxic side effects. Imipramine was the first tricyclic antidepressant to be introduced in the late 1950s. This graph shows the decline in institutional population in the United States. As you can see, the decline started after the introduction of chlorpromazine and continued as imipramine and lithium were subsequently introduced. We will now look at the history of the development of some physical treatments in psychiatry. Insulin coma therapy, deep sleep therapy, leucotomy, and electroconvulsive therapy or ECT. Insulin coma therapy was also called the insulin shock therapy. It was introduced by an Austrian physician, Sackel. It was commonly used to treat schizophrenia till the advent of neuroleptic antipsychotics. This treatment involved inducing coma by injecting insulin. After about an hour of coma, it would be reversed by injecting glucose. A typical course of insulin coma therapy would involve at least 50 such sessions, 6 days a week for 2 months. Early treatment, that is, starting insulin coma therapy within 3 months of illness onset, was reported to lead to remission in 75% of cases. Perhaps the benefit occurred due to seizures that were common during treatment. Modified insulin therapy, where a sub-coma dose was used, was employed to treat neuroses. Deep sleep therapy was also called continuous narcosis or prolonged sleep treatment. Treatment involved inducing continuous sleep artificially, mainly by using barbiturates. It was used to treat psychotic disorders. Deep sleep therapy was associated with unacceptable levels of mortality, drug side effects, pulmonary embolism, bronchopneumonia, etc. Leucotomy was also called lobotomy or psychosurgery. It involved severing connections to and from the prefrontal cortex. As with other physical treatments, its use declined sharply after the advent of medication. Leucotomy was introduced in 1935 by Egas Moniz, a Portuguese neurologist. He won the Medicine Nobel Prize in 1949. Currently, minimally invasive, highly specific neurosurgery is used very occasionally for severe treatment-resistant disorders. We will now briefly look at the history of electroconvulsive therapy. In the first half of the 20th century, there was a wrong assumption that epilepsy and schizophrenia never occurred together. Hence, artificially induced convulsions were postulated as treatment for schizophrenia. Ladislas Meduna in Hungary was the pioneer of convulsive treatment. Meduna induced seizures using intramuscular camphor. Subsequently, electrical current was used. Early ECTs were unsophisticated, so they were administered without anesthesia or muscle relaxants. This resulted in fractures. Modern ECT is very safe and highly effective if used appropriately. For pioneers in psychotherapy, please refer to my lecture on Introduction to Psychotherapy. Psychology is a closely allied discipline to psychiatry. So in this slide, I have mentioned some of the pioneers in psychology. So for those who are interested, you can pause and note down the details. This brings us to the end of this lecture. Hope you found the presentation informative and interesting. Thank you for watching.